Aloha, Happy New Year. I'm Josh Green, your host at Healthcare in Hawaii here at Think Tech Studios on Oahu. Over the last several months, we've been engaging in a very vibrant discussion with many healthcare leaders across our state about the state and the future of healthcare in Hawaii. We've also taken up some of the federal questions that are associated with the Affordable Care Act, otherwise known as Obamacare. Today we're going to be asking ourselves serious questions about Hawaii's Health Connector. I've been lucky enough to have a relationship with those leaders in that program, and today we have Tom Matsuda, the Interim Executive Director of the Hawaii Health Connector. A lot of people know this as the new way to get health insurance in our state. It's a central part of Obamacare, the Affordable Care Act, in which we're attempting to get the other 35 to 50 million or so individuals in our country health care insurance coverage so that they can get the care that they need. It's been controversial across the country. People throw a lot of mud at the wall when they see a big new plan for change, but I've been very gratified that our state's taken a proactive lead with the help of people like Tom. A lot of people question what the program's about. It's very complicated, and that's why we have him here today to help us understand this program. So Tom, why don't you tell us a little bit about yourself, tell us what your job is at the Health Connector, and we'll just dive into this.
I just became the Interim Executive Director of the Connector about a month ago. I came from the Governor's office where I was helping the state government to implement the Affordable Care Act. The Connector is a part of that. It's a very important part, but it's not the whole picture with the Affordable Care Act. And so what I'm doing now is just trying to help the Connector get up and running so that it can serve the people of Hawaii, and especially those folks who are uninsured, who are looking for better health insurance, hopefully at more affordable prices.
It's very interesting because, like you said, it's not the entirety of the Affordable Care Act, but in many ways it's become the face of the Affordable Care Act. This is the first kind of thing people seek. Why don't you explain to us a little bit, what are the most important parts of the Affordable Care Act from your perspective?
Okay. The old way of buying health insurance was either through your employer, or if you had to get it yourself, you would go to the insurance companies and shop around from one insurance company to the other until you could find the best plan that you could afford. Or your employer would do that for you and give you some choices to enroll. But it was kind of a confusing or cumbersome process. You didn't really know what was available to you. The purpose of the Connector is to make that whole process of choosing health insurance, trying to figure out if you can afford it, a lot easier. And the way that it does that is to set up two things. An online shopping experience where you can go to a website and enroll, submit an application, and then you can eventually see and compare health insurance plans side by side. Compare the benefits, compare the prices, and then make a choice that's best for you and your family. That's the first piece. The second major piece of what the Connector does is to go out into the community and to provide information and resources about health insurance, about how the Connector works, and especially targeting people who don't have insurance right now. Those are the major beneficiaries of the Affordable Care Act and the Connector. In Hawaii, we estimate that that's about 8% of the population, maybe about 100,000 people. And we really want to try to reach out to those folks, and especially those who need medical care. If they have insurance, it's going to be a lot easier for them to be able to get the care they need. So the outreach piece is happening on all islands. Through what we call assisters, marketplace assisters, and they're trying to reach out to folks all over the state to let them know about this opportunity to get health insurance.
So let me, this is very helpful already, I can tell. So let me take a half step back. Historically, many people say Hawaii is one of the better states as far as getting coverage, and this dates back, I think, to the 1974 Prepaid Health Act, which basically said, look, if you have a job and you work half-time or more, your employer will provide you health care insurance. You'll pay a little bit, but the job itself will provide you health insurance. So that got us to the point, I guess, that you're describing where only 8% or so of our people are uninsured. flash forward then to 2000, 2010, 11, 12, when the bill got passed at the federal government level. President Obama steps up, says we're going to pass health care reform. Here we go. So now everyone's going to have health care insurance, or almost everybody. Who are the people in Hawaii that are uninsured still? Who is that 8%?
Well, it's not the lowest income people, because those folks are eligible for Medicaid.
Right.
What we're talking about is maybe the working poor, or people who have just graduated from college who don't have a job yet.
Okay.
Or in some cases, families that are struggling, where maybe one spouse is working but the other one isn't. There's a variety of combinations, but there's a lot of folks who just have not made health insurance a priority for different reasons. Either they can't afford it, or they've got other issues that they have to take care of. And those are the folks that we're trying to reach out to and help them understand that this is a new opportunity.
Right, and it's a challenge, I think, especially especially as we've discussed before, convincing a very young person, someone who's 27, 28, 29 years old, who's never had a health problem perhaps, who's never needed to get health insurance, but now it's the law, right?
Yes.
And how do you convince that person? How do you find that person? Tell me what your experience has been.
Well, it's interesting. A lot of younger folks actually do understand the importance of obtaining health insurance. Everybody knows somebody who's had a bad accident, or has gotten sick and needed health care, and then they get hit with that bill.
Yeah.
Right. And so unfortunately, some people have to learn that lesson the hard way. But eventually, through word of mouth and through the life experiences that people go through, they understand that sometimes it's better to have that insurance up front.
Yeah.
And especially for younger people, if they can get what's called a catastrophic plan, which is usually a lot less expensive,
Yes.
they can get that basic coverage for those unexpected times when they might need to go. Otherwise, their option is to show up at the emergency room
Yes.
with no insurance, and then they get hit with a gigantic bill. It's the most expensive way to get health care.
Yes.
And that's what we're trying to avoid, is to deal with these issues up front instead of after the fact.
And in time, and maybe in the second part of our show, I do definitely want to get into the scope of plans so people can understand that better. But yeah, it's no secret that I'm an emergency room physician, and I tell you, I have so many. And my heart breaks for people that come into the ER when they should have had insurance.
Yeah,
I always make sure we do everything we can to get them insurance right then. But I have innumerable stories to tell of an individual comes to me just this past weekend over the holidays, came in with a bad infection. This is a real story. Individual comes in, he knows he needs antibiotics, he doesn't have insurance yet, and even with the opportunities that have been made available in the last few months, still hasn't gotten healthcare coverage. And he actually told me, Doc, he was a very smart young guy, he said, can you not give me intravenous antibiotics or keep me here too long? I know it's going to cost an arm and a leg, and I just am not going to be able to afford it. And I'm sitting there thinking, I need to give this gentleman the best treatment possible, but he is already asking for substandard treatment that is too quick or doesn't give him as much hope for recovery, just because he's worried about the economic impact on his life and perhaps his young significant other and so on. So that's one of the real reasons, I think, to get people insurance, so that we put aside these questions about what kind of treatment. We just say we're going to give people the best treatment, and that's where we want to go.
I wish I could have talked to him 2 months ago.
Exactly.
He could have gone through our system and gotten insurance, and he would have been covered last weekend.
And that's I think the reason that people are seeing a lot of advertising and seeing a lot of outreach right now is because I'm the first to admit, any year we start a big program, I hope people are understanding it's going to be bumpy and it's going to be a challenge, especially something of this complexity. Tell me a little bit more about the uninsured people that you've been talking to, because we have an hour here.
Okay. The other really important part of the Affordable Care Act, I think it's maybe the most important part, is that it used to be legal for insurance companies to deny coverage if you had a pre-existing condition. And starting this past January 1st, that's no longer allowed.
You mean just a few days ago, or are you talking
no, just
a year?
a few days
Yes.
ago. Okay, so some of the people who really lined up to apply for health insurance through the connector were those folks who have been denied insurance for many years because they had a medical condition, and since that's no longer allowed, they wanted to sign up as soon as they could to get coverage so that they could get some of the expensive treatment that they've been needing for years.
Let me tell you a story about that and ask you a question too. So there's a woman in my community back in my Senate district on the Big Island who she had breast cancer many years ago, and when she went to get health insurance a few years back, she was quoted astronomical annual costs, $35,000–$40,000 a year for health insurance. And even though she was somewhat affluent, she was working, as was her husband, they really just couldn't make that decision to get the insurance. Instead, they wanted to give the money to their grandchildren, basically. What's the scenario now for a person like that?
Well, in the old days, when that person was applying for insurance and filling out that application form, there would be all kinds of questions about medical conditions and prescription drugs and all that other stuff. Now, if you fill out that application, none of those questions are there. The insurance companies have to provide you, it's called guaranteed issue. They have to issue the insurance to applicants regardless of their medical condition. That's a huge difference in the law.
That seems to be a pretty profound change. What are the other major changes that you are seeing as beneficial to society?
Well, the part that's gotten focus in the newspaper and everything else is the affordable part of the Affordable Care Act. Where that comes from is there are two major tax credits that are available through the federal law. One is for individuals and the other is for small businesses. And the idea is if you meet certain income guidelines when you apply for insurance, you will be given a credit against the cost of your insurance. So it actually reduces the bill that you have to pay for the insurance. And the only way you can get that tax credit is to apply for insurance through the connector. So when you fill out the application, it includes questions about your income and your family situation as well, so they can determine who needs the insurance in your family and how much your income is. And if you are up to 400% of the federal poverty level, you can qualify for this credit, which offsets the cost. That's the part that's supposed to be affordable.
Got it. So, and I understand that in people's applications they have been doing that. Is that right? Okay.
Yes, that's right.
And someone told me once that as many as 80% of those who apply through the exchange will have some sort of support. Is that a number that we're bearing out? How's that playing out?
We're so early into the process that I haven't measured that yet. But we do know that a number of people that are coming through our system are eligible for this credit that's called the Advanced Premium Tax Credit. And our system is designed to filter those people and determine if they're eligible.
Got it. And so just so I can clarify this for our viewers, they apply through the exchange.
Yes.
And it tells them once they've gone through the process, you qualify for this plan, or this is the plan you've chosen, because everyone qualifies, and this is what the cost is per month because you're getting this amount reduced. Is that how it works?
Yeah, it's not a tax credit that shows up when you file your taxes at the end of the year. It's a tax credit that shows up right when you pay the bill for the premium. And then, so it reduces your out-of-pocket cost right there.
Interesting. And then who do they begin to pay?
The insurance companies. So we are not an insurance company. All we are is a place for people to come to look at the insurance plans that are offered, in our case, by either Kaiser or HMSA. And there's 95 different plans available from those two insurers on the Hawaii Health Connector. And so they can compare them side by side. There's different benefits, there's different costs. And so they can just look at those and decide which one is best for them. Once they choose a plan, and the premium is displayed on the website, then if you qualify for these tax credits, it's subtracted from that premium and you pay the net amount.
Fascinating. I think this is a good place for us to take our first short break. And then when we come back, I think we're going to dive right into the scope of those plans and give people an understanding about what kind of coverage they'll get if they go through the Hawaii Health Connector.
Okay, very good.
Again, this is Josh Green. I'm your host at Healthcare in Hawaii. Thank you for joining us.
I'm Hong Jiang, host for Asia in Review on Tuesdays.
And I'm David Day, host for Asian Review on Thursdays. Both of us broadcast our respective shows at 4 p.m.
And my topics tend to deal with questions related to environment, culture, history, and sometimes human rights.
And my shows tend to be on international business, foreign policy, geopolitics, and national security. And you can watch our shows live on the ThinkTech website at thinktechhawaii.com.
And you can also watch us on YouTube or Olalo.
So come join us on Thursdays at 4 p.m. I'm David Day.
And on Tuesdays at 4 p.m., I'm Hong Jiang.
Aloha.
Aloha.
Aloha. Welcome back to Healthcare in Hawaii. I'm your host, Senator Josh Green from the Big Island, ER physician, and in this case, a moderator in a very important discussion. Today I have Tom Matsuda, who's the interim executive director at the Hawaii Health Connector. This is the program that, as a result of the passage of the Affordable Care Act, otherwise known as Obamacare by some, enabled us to pursue health insurance coverage for everyone in our country. In our first 15-minute segment, we had the ability to explore the number of people that are uninsured in our state. Tom told us that about 8% of residents in Hawaii have historically been uninsured. That amounts to 100 or 105,000 individuals. And it's not just the people who are poorest in our midst. Those individuals have Medicaid coverage. At this point, there are about 295,000 or so Medicaid covered individuals, and that number may increase. The people that are currently underinsured or uninsured in our state are often the working poor, people who have a couple jobs that aren't even half-time, or maybe for some other reason hadn't qualified for health care coverage in the past. Now with the Affordable Care Act, you will be guaranteed insurance. It's called guaranteed
issue.
Guaranteed issue. And so everyone who applies for health care insurance is going to get it now. In fact, it's a mandate under the law that we all do apply for health care insurance in our country. What I want to do now with Tom, as we've laid kind of the foundation of the reason for having the Health Connector, is I want to look at the scope of the plans. He should tell us what the website is called. And then we'll talk about these 95 plans that are available to our citizens. So why don't you first give us the contact information, Tom? Where do people go on the web? Who do they call?
The website name is the hawaiihealthconnector.com. hawaiihealthconnector.com. And I'm sorry I don't have the phone number memorized, but I can get that to you in the next segment.
That sounds great.
So the idea behind accessing the connector is that there should be no wrong door. People can go directly to the website to try to enroll. They can also contact our call center, which is the number that I'll get for you. They can also contact these assister programs that I mentioned in the first segment, and the list of those programs on each island is on the front page of our website, and that includes their phone numbers if people want to have a face-to-face conversation about what all of this means. So we're trying to make it as easy as possible to access the system.
Right, and people commented on some of our growing pains, both nationally and locally, and to some degree, I think it was overstated because just like any new technology or initiative, there's a lot of there's a big learning curve, and there's reticence by people to do something new. I think some people stuck with their plans perhaps when they might have benefited by going through the connector for some of the tax credits. It is clear that you could keep your previous plan for the most part, especially since most people do have HMSA insurance or Kaiser insurance. That represents, I don't know, over 90% of our insured individuals in the state. But now you're saying it's very available. You mentioned earlier that you have people doing outreach. Who are those people again?
There are about 35 different nonprofit organizations on every island who applied to us for a grant from our federal funds to enable them to hire people to function as these assisters to the public on all islands. And they are trained by us in all of the rules and the process for enrolling in health insurance through our system. And so they are maybe a very good source of information to folks who are not really comfortable going directly to the website or need to understand the rules about health insurance, especially in this changing environment that we're in. So as I was saying earlier, if you are listening to this program and you want to contact those folks, you should go to the website, and there's a list of all of these 35 organizations with the phone numbers, and that's the best way to reach a friendly voice over the phone or even face-to-face to get some of this information.
And if I'm not mistaken, some of these people are the very health professionals that they might have experienced in their community, a community health center,
Yes.
Maybe a local Rotary or something of the sort, where local community organizations that have applied, they know a lot of people in their local communities.
Yes,
And
that
we're
was the whole idea.
Yeah,
Right.
and we're a local society, so I think that was awfully smart. And otherwise, though, you can simply go to HawaiiHealthConnector.com and just do it. I think that's what I did.
Yes.
And so, but for people who aren't tech savvy or who would like a little extra help, they do that. And then I'll tell you what, I'll give you a prediction. I think this first year was challenging because it's new, and people have their regular. We're a suspicious bunch in our country sometimes when something is very different. I bet you anything in the second and third years it's going to be old hat.
Yeah.
And
Look, Senator, I want to be honest with your audience. We had challenges when the website opened, and I think a lot of people know this. But right now, today, people need to know that our system is working. You can submit an application, you can compare the different plans, and you can enroll in a health insurance plan. You can go from the beginning to the end of the process. It's not perfect. There are parts of it that are slow or sometimes a little bit confusing, and part of my job is to make sure that we upgrade it and we continue to improve it and make it easier for consumers to use. But it's not true that the system is broken. It is working from end to end, and now we're just trying to make it easier and better to use.
to that end, how many people have signed up, more or less now?
Just for the individual side, the individuals who are looking for insurance, as of last night, we had 2,600 people sign up, but there's a lot more applications that are pending in the system. Part of the reason for that is in order to get, if you want to get the financial assistance, the tax credits, the first thing you have to do, and this is the federal law, in order to get the tax credit, the first thing you have to do is apply for Medicaid. And you can only get the tax credit if you go through that system and then you are denied Medicaid, which means you're above the income limits. And then you come into our system and you can apply for the tax credits. So that process is a little bit slower. And so many of those applications are pending, but as they come in, we're taking them into our system and running them through.
And once that small backlog gets, then we're talking many more thousand? Is that?
Yes. Okay. Well, that's our goal. We're trying to enroll as many people as we can.
Terrific. Tell me a little bit more about this process. Someone comes onto the website, they now see multiple plans. They apply first through the process to see whether they qualify for Medicaid.
Well, actually, the first thing they can do is what we call anonymous browsing, which means you can go onto the website and just take a look at some of the plans that are available without giving up any of your personal information, if you just want to see what it looks like. And then, based on that, if you decide that you really want to go into the process further and actually shop for a plan, then you have to fill out an application. That's a little bit tedious. You have to fill out a lot of information, but it's all required by the law to get through the process. Once you fill out that application, then you'll be able to see the actual plans that are available for you at your income level, and then you can compare and shop and make a selection.
So tell me a little bit about the plans. That's one of the things we promised people in the last segment. You said there are 95 plans. Give me an idea about how you compare these plans. What's the difference between some of them?
Okay. The major difference in the plans is how much, well, let's say you have a medical procedure that costs you $100.
Yes.
Out of that $100 bill, how much is paid by the insurance company and how much do you pay out of your pocket? There's 4 levels or 4 categories of plans in the connector. The first is what we call the 90-10 plan or the platinum plan, which is the insurance company pays $90 out of that 100 and you pay $10 out of your pocket. And the other categories are 90-10, 80-20, which is the gold, 70-30, which is silver, and 60-40, which is bronze. So you have platinum, gold, silver, and bronze level plans. And of course, down at the bronze level, the amount that you pay for premium is less. But if you're paying for the platinum pen, you pay a lot more. But when you have the medical procedure done, the insurance company pays most of the bill. So that's where people have to make a choice. They have to compare what they can afford in premiums versus how much they think they're going to have to pay out of pocket when they go to the doctor's office.
Has this always been the case for people? I mean,
No.
I assume that this is something new. So historically, if you were in Hawaii, what kind of plans could you get?
Well, if you were an individual shopping on the individual market, chances are you were paying a lot more for lower benefits.
Okay.
So you were more likely to be buying something like a bronze or a silver plan, but paying a lot higher in premium. Now you're given a much broader choice and range of options, which is a really important part for people to understand. Part of the comparison, for example, is a copay. When you show up at the doctor's office, how much do you actually have to pay right there just to get the service versus getting the bill later on? These plans have different copay levels, in addition to the different metal levels that I was talking about earlier. So that's where it gets to be maybe a little bit complicated for folks that have never shopped for insurance before. That's why we hope that our assister program or the call center can help people to understand their choices.
So should people expect when they go into the website and first look at, should they go a couple times and experience it, do research before they push that button and send in their application? Is that what you recommend?
Yeah, and especially if they go into it and they don't understand it or they have questions, that's a good time for them to call the contact center or to reach out to one of these assister programs and get those questions answered before they make a choice.
What have people been doing? Have they been doing that? They've been seeking help? I think I read that you had a huge influx of additional calls right before the new year.
Right. The reason for that was if people wanted to have coverage starting on January 1st, they had to go through and make a selection by December 24th.
Okay.
And so we, starting around December 18th or so, we had a huge increase in the number of people coming on board to look at the plans because they wanted coverage by January 1st. The next one for people in your audience that's coming up is if they want coverage by February 1st, they have to go through the process and enroll by January 15th.
Is it the 15th of every month going forward
Yes.
to get activated for the 1st of the next month?
Right. And then what we are now in what's called the open enrollment period under the Affordable Care Act. That first open enrollment period for individuals is going to finish at the end of March, on March 31st.
Okay.
So the last opportunity people are going to have for this year is going to be on March 15th for March 31st.
And I think that's also important because the mandate, right? The
Yes.
federal mandate asks that everybody be insured. What happens if you're an individual out there and for whatever reason you don't go get insurance? You make that choice. There will be a penalty?
Yes. At the end of the year, when people file their taxes, they're going to be asked a question about whether or not they have health insurance. And if the answer is no, if they made that choice, then at the end of the first year, there will be a tax penalty. For individuals, it'll be $95 or 1% of their income, whichever is higher. And then that's for tax year 2014. In the following year, the penalty goes up to $395 or 2% of income. And then it tops out on the third year at $695 or 2.5% of income. So that's a penalty that's obviously is meant to encourage people to purchase the insurance because that's required under the law.
I got it. Well, I think that's a pretty good place for us again to draw a line and finish this segment. And then when we come back, I think we're going to dig again deeper into comparative plans, why people might choose one over the other, and what their options are for getting health care.
Okay.
We'll also probably work on dispelling some of the myths that have been out there, and we'll share with our audience additional opportunities going forward.
Okay.
Okay,
Good.
great. So again, this is Josh Green, your host at Healthcare in Hawaii. I'm joined today by Tom Matsuda, the Interim Executive Director of the Hawaii Health Connector. This is an important discussion because we think everyone should have healthcare insurance in our country, and particularly in our beloved state of Hawaii. Thanks for joining us.
Aloha, I'm Nicole Horry for ThinkTech. For nearly half a century, the Hawaii Foreign Trade Zone No. 9 has brought the benefits of the Foreign Trade Zone program to Hawaii businesses and entrepreneurs. DBET, the Department of Business, Economic Development, and Tourism, operates Hawaii's Foreign Trade Zone program to encourage international business and economic development. The Foreign Trade Zone's mission is to increase the amount of international trading activity in Hawaii, thereby providing employment opportunities for the residents of our island state. For more information, see ftz9.org. I'm Nicole Hori. Mahalo.
Aloha, Happy New Year again. I'm Josh Green, Senator from the Big Island and your host at Healthcare in Hawaii. Today I'm joined by Tom Matsuda, who is a very important individual in our state. Tom is the interim executive director of the Hawaii Health Connector. A lot of you know this to be a significant part of the Affordable Health Care Act, which is also Obamacare, which provides the basis for getting everyone health care in our country. Specifically, what we're talking about today is getting everyone healthcare insurance in the state of Hawaii. Historically, as Tom pointed out, only about 8% of our people have been uninsured, but that 8% can suffer dearly if they get into an injury, they have an accident, and then have a catastrophic bill that would affect perhaps much of their family or their entire lives. Other people have other reasons for not getting healthcare insurance, but from the standpoint of the federal government, we're trying to encourage everyone in our country to both get insured and be responsible for that part of their life. If you go and get healthcare insurance and you don't have a lot of money, you may qualify for Medicaid, which is a part of going to the Hawaii Health Connector. That will get you insurance for free. But otherwise, you may very well receive a subsidy, as Tom has described, right up front. So you don't have a big out-of-pocket expense for this new healthcare insurance, which is mandated. We also want to talk about some of the scope of the plans. We've talked about anything ranging from the top quality plan, which is a platinum plan, and that would provide 90-10 coverage. 90% would be covered when you pay your bills at a hospital or at a doctor's office, down to a lower level coverage, say bronze, where you might only have 60% covered. Of course, that would be a less expensive plan. But now I want to get into a little bit more of the impact on the state of Hawaii. So Tom and I discussed during our break, maybe addressing what it means to small business owners. Small businesses provide most of the jobs here in the state of Hawaii, as we've talked about through Think Tech on many of our programs. So why don't you help me with that dialogue here, Tom? What's the impact on small businesses for the Hawaii Health Connector?
You know, the Affordable Care Act has really two major goals. One is to provide insurance for individuals, and the second one is to provide a means for small businesses to provide insurance to their employees. And what we mean by small business in Hawaii is businesses that have 50 full-time employees or less. What is available through the connector, what we've been talking about in the first two segments is insurance available to individuals.
Right.
But there's a separate part of our system that is available to small businesses and their workers. The way it works, the process is straightforward. The employer goes to our website first and registers as a small employer who wants to provide insurance to their workers. They fill out information about the business, the location, the number of full-time employees, and some of their identifying information. And then the employer selects the plans that they want to make available to their workers. Then the employer notifies the employees, and they go to the website and they look at the plans that are available and choose the one that's best for them and for their families. Of course, there's a choice in there for the employer about whether they choose to cover dependents or not.
Mm-hmm.
That's consistent with the existing state law. So right now, it's really meant to be a convenience for employers, a different way for them to get their workers enrolled. The major difference between what happened before Obamacare and now is that a small business tax credit is available to certain categories of small employers to reduce the cost of the premiums that they're paying for their workers. And that's part of the application process when the employer goes in. The basic rule for the tax credit, if any owners are out there listening, is that you have to be a small employer, 50 employers or less, and their average salary annual has to be $50,000 or less.
Okay.
Those are the basic rules to qualify for the tax credit.
Okay.
And again, that tax credit is only available through the connector.
And who gets that tax credit? So let's say I own a small business. Let's say I own a shave ice company, and I employ 10 people. My 10 workers each make, or on average, make less than $50,000 per year. Some of them may be family members. Some of them may be members of my community or my church or goodness knows what. But they have 10 employees. I've already been historically paying their health insurance because it's the law. They work full time. How does it work? We make some money at our business, and it's been expensive. The small business owner says, to get coverage for all these people. Do I get that benefit right off the bat? Do I get it at the end of the year? How does it work?
You get it at the end of the year when you file your tax return. And it's important for me to say that to the business owners out there that the tax credit has been available since the law passed in 2010. So if you've already filed your tax returns for 10, 11, 12, and you think you might have qualified back then, you can file an amended tax return and try to get some of those credits. But from now going forward, those tax credits will be realized when you file your tax return at the end of the year.
How big is this tax credit for small businesses? How big can it be?
Starting this year, this past January 1st, it's substantial. It's 50% of the cost of the premium that the employer paid.
Holy cow. So
up to 50%. So,
and it depends on what? Profits? How well your business is doing, or does it just depend on the kind of people that you hire?
It really is a factor of the salaries that you're paying. Okay, so if you are paying your workers an average that's closer to 50,000, the amount of the credit will be less.
Got it.
Okay.
So basically, if you are, let's say you're running a big business with a lot of employees that don't make a whole lot of money, but you want to give them health care coverage, we're saying that the plan, the Affordable Care Act, and in this case, our Hawaii Health Connector, is enabling you to get as much as half of that money back that you pay for their insurance premiums. Is it because, well, healthcare is pretty expensive and maybe you're only paying them $25,000 a year, but that healthcare insurance is going to cost a fair amount?
Right. Now, here's an important difference between Hawaii and the rest of the country.
Okay.
The reason that tax credit was set up for the rest of the country is that in most states, employers, and especially small employers, are not required to provide insurance to their employees. But in Hawaii, we're different. You mentioned the Prepaid Healthcare Act earlier, and that law says that if you have even one employee who's working at least 20 hours per week average,
right,
you have to provide health insurance. So the interesting thing for us in setting up this system for small employers was we had to make that state law a part of the enrollment for health insurance. So for those of you out there who are interested in this, and if you're already covered by the Prepaid Healthcare Act, your experience going through our system should be the same as what you already had under prepaid before Obamacare happened. We're trying to protect the state law because in many respects it's better, I think, than Obamacare.
Right, and I think that's been a part of the dialogue. We've been trying in Hawaii, and we've been in a unique position to try to take what's best from the healthcare law. And the idea of creating the connector was to add some of these opportunities.
Yes.
Had we not done that, what would have been the consequences?
Well, you know, there would not have been as good access to insurance or as good quality of insurance available, especially to individuals. But on the small business side, you know, we already have a system through prepaid that works pretty well. That's why we didn't want to water it down. We wanted to protect it as much as we could.
Right, but now we're talking about making sure small businesses get the benefit that states like California and New York, others get, to put some of that money back into the small business owners' pockets.
Yeah, especially through the tax credit, that's right.
And I think this is an important point, right? So if a small business chooses to not use the connector, then they're not going to be able to qualify for the tax credit.
That's right.
Okay, so that's almost a non-starter, I would assume, for a lot of small businesses, right? It's a lot of money.
Yeah, and you know, if folks are unsure, they can go onto the website, and there's actually a tax credit calculator for small businesses, so they can input the basic numbers for their business and make an initial determination whether they're in the ballpark or not.
Right.
And then if they are, then they can just try to go through the system and apply for the tax credit.
Let me shift gears just a little bit. We've about 5 minutes left in this segment, our third segment today. What are we seeing as far as the cost of healthcare insurance? Has it changed significantly this year with the launch of the Health Connector? Is it going up? Is it going down? What are people experiencing?
I had the good fortune to work pretty closely with our insurance commissioner, Gordon Ito, on some of these issues. And he had a very interesting set of statistics about the rate of increase of health insurance costs over the past few years. And it was really averaging in the double digits for the past 10, 15, 20 years. It's hard to say at this point whether it's due to Obamacare or not, but over the past 3 years, it's been dropping into the single digits. And of course, the goal of the federal law is to bend that cost curve and to slow down the rate of increase in health insurance. Time will tell. It's too early to see if the connector is going to make that kind of an impact, but we're going to be watching that to see what happens. The idea behind it is if everyone has insurance and if there's more emphasis on preventive care up front instead of going to the emergency room after it's too late, hopefully what that will do is it will reduce the cost of health care over time, and that will bring the rates down. That's the theory, and we just have to wait and see if it's going to work.
Yeah, and I would add to that, and I think it's a pretty sound theory, but in addition to that, if we look at our country as a whole, Hawaii, yes, we're a bit unique because our number has been lower at just 8% uninsured, but there are some states out there where it's 20 or 30% uninsured, Texas, for example. And when you have that many people uninsured, but they still go to the community hospitals or to the community clinics, and there's no reimbursement at all, I like to say often when I'm in the ER, there's no shortcut. Someone in society is going to have to help out and pay for services that we really need. We need community hospitals. We need these critical access hospitals in the countryside. We need community health centers. And if everyone's not insured, those who are insured are going to pick up a slightly larger hunk of the bill. And so I think this is not theory, that if everyone ultimately gets insured, or say 98% of the country is insured, it's everyone bearing a kind of a more even piece of the expense, and I'm hopeful that that will bring down the costs of everybody's premiums, and also it could even bring down some of the need to have taxes that are paying for a lot of these really essential healthcare services. And I think that's a very significant reality that we should face in our state for certain, and I can't speak for other states. We are very community oriented, and it's very Ohana based, right? So I think that the premise of the Affordable Care Act and getting everyone insurance and everyone kind of carrying their share of the load really fit well with Hawaii. Again, I'm not going to say it's for everybody, and I know some people don't like mandates, but I think if people look at it in terms of we're all carrying our load, and they also realize that the long-term consequence might be that the taxes are less to support the Hawaii Health System Corporation, which needs extra support because there are plenty of people uninsured that we take care of, that might really pay off in the end for us. So I'm hopeful.
Well, we just, at the Connector, we hope to play our part in supporting that whole effort, to bend the cost curve, because the ultimate goal is to improve the health of everyone in this state, and we just hope that we can play a part in that.
Well, I think you are so far. Tom, you had the phone number, I believe, for us?
Yes.
What is that number?
This is for our contact center for folks who want to ask questions about the Connector or to try to enroll. The number is 1-877-628-5076, and I'll repeat it again, 1-877-628-5076.
And one more time, the website?
HawaiiHealthConnector.com.
Okay, well, please, we'll ask people to share that with their friends and family. We're going to take our third break, and then we'll come back just for a few more minutes to talk about what you expect in the coming years from the Health Connector.
Okay, thank you.
Great. Again, I'm Josh Green, your host at Healthcare in Hawaii. Thanks for joining us today.
Aloha, I'm Jay Fidel for ThinkTech. For nearly half a century, the Hawaiian Foreign Trade Zone, number 9, has brought the benefits of the Foreign Trade Zone program to Hawaii businesses and entrepreneurs. DBED, the Hawaii Department of Business, Economic Development and Tourism, operates Hawaii's Foreign Trade Zone program. It does so to encourage international business and economic development. The Foreign Trade Zone mission is to increase the amount of international trading activity in Hawaii, thereby providing employment opportunities for the residents of our island state. For more information, see ftz9.org. I'm Jay Fidel of ThinkTech. Mahalo.
Aloha. Welcome back to Healthcare in Hawaii and Happy New Year. I'm Josh Green, your host, member of the Senate Health Committee, the chairman, and also an ER doctor. Today I'm joined by a special guest, Tom Matsuda, who is the interim executive director at the Hawaii Health Connector. It's a very important role for us in Hawaii because we want everyone, the last 8% of those who are uninsured, to get insurance as a result of the Affordable Care Act. Tom has been very gracious with us talking about what the connector does, how small businesses can benefit, how individuals can get health care insurance because they no longer can ever be turned down when we apply. Health insurance still isn't cheap. It's expensive for a lot of us in the middle class. If you're poor, you might qualify for Medicaid, of which about 300,000 individuals in Hawaii do. But there are a bunch of people out there who haven't been able to get health care insurance and therefore care. And that's, I think, something that Tom is very diligently committed to. In the last few minutes of our show, I want to turn back to Tom and ask him what we can expect from the Health Connector in Hawaii, what we think it will look like in the coming years, and whether we will ultimately insure everyone in our state. So Tom, we have a few moments left in our program. Tell us what it looks like today and what it'll look like in a year.
Well, we just launched in October. As I said in an earlier segment, we are now able to take applications and enroll people in health plans. Really, our short-term goal until the end of open enrollment at the end of March is just to try to improve the system and make it easier for folks to use so that they don't run into some of the delays and other problems that they've had. After that, the next period of open enrollment, this is going to happen every year.
Yes.
The next period of open enrollment starts in November at the end of this year. So between now and then, we're going to continue to try to improve the system. For small businesses, the enrollment period just keeps turning over every month, depending on when people had their open enrollment in the past in their businesses. What I understand is that most small businesses in the state have open enrollment starting for July 1st. So we're going to try to work with the small businesses all the way through the summer. After that, it's really going to be about making sure that this entity called the Connector, really becomes an important part of that healthcare transformation effort that you were talking about just a few minutes ago. And that's going to be a conversation, I think, with the community, with the legislature, and with the healthcare industry, to make sure that people understand the opportunity that they have with this new entity that's been created with federal funds, because our hope is that it's going to continue to exist and be a useful part of the community for many years to come. But that's a community conversation to make sure that we figure out how to make the best use of this thing that we're building.
Do you expect to go out and have discussions with the community once the dust settles on this first period, to go and ask them, what would you like to see in the Health Connector, and did it benefit you? Because I think that the small businesses will appreciate that, and I know that, like we mentioned earlier, with any new product, there are big questions in that first year.
Right.
And then when we come around, we take some of the kinks out of it, we smooth over some of the bumps, and we'll see where it is.
Yeah, that's right. I really do want to have that conversation. We are fulfilling a public purpose that was defined for us by the federal law and by state law. And therefore, I think we at the Connector have an obligation to make sure that we are doing what the community feels is valuable. So that has to happen from a dialogue that's going to happen both out on the neighbor islands and on Oahu and with the legislature to try to figure out what is the best future for the Connector.
Why don't you tell them again where to go? Give us the website first.
Okay, the website is Hawaii Health Connector, no punctuation, hawaiihealthconnector.com. And the contact center phone number is 1-877-628-5076.
Thank you so much, Tom.
You're welcome.
So I guess just in closing, this is an opportunity here in the new year for fresh starts. We've had an excellent discussion with Tom Matsuda, the Interim Executive Director at the Hawaii Health Connector. 8% of you out there in our community have historically been uninsured in the state of Hawaii. That means every one of us has a friend or family that needs some help with their health care coverage, and I hope that you'll convey this message to them. Go to the Hawaii Health Connector and look at it. Compare the 95 plans that are there. It guides you through it. I've been on this website. It's very good. Go look at what one plan is like compared to the other. Compare costs. Compare the total amount of coverage. Be aware that if you get coverage today, it may help you through a time of need in the future. We want people to be responsible for their lives. I want people to not smoke. I want them out there exercising, but I also want them out getting coverage so that if God forbid you need it, it doesn't cause a major disruption in your life. Too many people in America have gone bankrupt as a result of not having health care insurance, and it breaks the hearts of their parents and their grandparents to not be able to help them. Maybe this will be one of those solutions, and I'm glad that Tom's been a part of it. Thank you for joining us here at Healthcare in Hawaii. My name is Josh Green. I'm your host. We're going to continue to have these discussions to make sure healthcare is more accessible, more affordable, and better quality for everyone in our state. And today I hope that you've learned a little bit about the Hawaii Health Connector and how it will achieve that end for us as a part of our healthcare system in our state. Thanks again for joining us. We'll see you next week.